Good afternoon, everyone. On behalf of the Clinical and Translational Science Collaborative of Cleveland, we welcome you and thank you for joining us. Before we begin, we'd like to share a bit about the CTSC. The Clinical and Translational Science Collaborative, or CTSC of Cleveland, is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Lewis Stokes Veterans Administration Medical Center. We aspire to be a catalyst for high-quality clinical and translational research, both locally and nationally, by changing the culture and environment of biomedical research, sharing resources and expertise, and streamlining the research process to move translational research from bench to bedside into the community. Every Thursday in February, we're investing 1 hour to learn about a current Black history maker. Today, we celebrate and meet Dr. Linda Bradley, our fourth and final Black History Maker Series honoree. Dr. Linda D. Bradley is a professor of obstetrics, gynecology, and reproductive biology at the Cleveland Clinic, Lerner College of Medicine. Dr. Bradley's clinical work includes director of the Center for Menstrual Disorders, Fibroids and Hysteroscopic Services. Recently, she was appointed vice chair for diversity and inclusion for the Cleveland Clinic Women's Health Institute. She is an internationally recognized gynecologic surgeon known for her expertise in diagnostic and operative hysteroscopy, evaluation of women with endometriosis, saline infusion sonography, and evaluation of abnormal uterine bleeding, alternatives to hysterectomy, long-term contraception, intrauterine devices and hormonal contraception, women's wellness, female sexuality, and menopause management. Additional academic interests include perimenopausal and menopausal issues, mentoring and sponsoring students, residents, and fellows, and she is the director of hysteroscopic education for the residency program at the Cleveland Clinic Lerner College of Medicine. She was recently elected to the board as medical director for the American Association of Gynecologic Laparoscopy, and she currently serves as an advisor for Medscape and WebMD. She served on the Cleveland Clinic Board of Governors and has been chair of the OBGYN section of the National Medical Association and president of the Cleveland OBGYN Society. Dr. Bradley was president of the American Association of Gynecologic Laparoscopists, an 8,000-member international and national organization which advances minimally invasive gynecologic surgical procedures. Currently, she is on the grievance committee of the American College of Obstetrics and Gynecology and member of the Anti-Harassment, Diversity, and Incident Reporting Task Force of the AAGL. For the past 19 years, Dr. Bradley has been dedicated and a servant leader in Cleveland's multicultural community health and wellness programs. She is founder of Cleveland Clinic Celebrate Sisterhood. She is passionate about fitness, health, and wellness and inspiring people to be the best version of themselves. Annually, she hosts Celebrate Sisterhood Multicultural Health and Wellness Summit. She has educated more than 10,000 multicultural women since its inception. Dr. Bradley earned a bachelor's degree in biopsychology from Vassar College before attending the University of Cincinnati College of Medicine for her MD. During her senior year of residency, she was named Executive Chief Resident and completed her residency training at Case Western Reserve University and Cleveland Metropolitan General Hospital in Cleveland, Ohio. She has completed an extensive program in practice management from the Weatherhead School of Business, Case Western Reserve University, and has completed the Leadership and Healthcare Academy at the Cleveland Clinic. Dr. Bradley believes in teamwork, innovation, collaboration, mentoring, and sponsoring others. She is someone who is content to not be content. Her belief is that all teams can do great things. This is best exemplified by her motto, create lights around you, put the light on others, and get the light off of you. All right, Dr. Bradley, the floor is yours to share about your work, and then we'll kick off the Q&A portion of your celebration. I'll bring up your slides now.
Okay, thank you so much, Ms. Thomas. I really appreciate this honor. I understand that this is the first year that the organization has done something like this. So I think it's very important to celebrate local and national, perhaps even international thought leaders. And I'm happy as growing up here in Cleveland, coming back to Cleveland after college and medical school to speak with you today. And when Ms. Thomas asked me to speak, a lot of different things kind of lingered in my brain about what would I speak about. And I'm at a point in my career. I've been at the Cleveland Clinic for almost 30 years. I am the first African-American female physician, not a resident, not an intern or a fellow when I joined, but board certified and later became professor in obstetrics and gynecology. And I do think that I am leaving an impact, a footprint, a thumbprint, both at my institution and in the local community. And my hope is not to just really talk about me, but to tell you sort of my journey, some thoughts that I've gathered along the way about taking care of women, leaving a long-term impact in order for us to build a better tomorrow and actually a better today. So with that, I'd like to just start off with some thoughts, some thanks, some gratitude, and then leave time for questions, because a session like this, speaking about what needs to be done, what does a physician really at 40 years practicing in obstetrics and gynecology see? What kind of impact have we left? Will we leave? I think it's important. So I'll start with the first slide, Ms. Thomas, which is just my disclosure slide. We're supposed to include this, and I do a lot of writing, have my own textbook, but I've also received royalties from other textbooks and educational venues. I'm also a part of the Up to Date program, which gives a lot of information for our students and physicians for practical topics in gynecology. And as mentioned, I'm currently medical director of the AAGM. Thank you. So first of all, I want to just raise my hands and give thanks to all of you who are in medicine and in other professions to take time out of your day to be here, and maybe even pass the message on. This will be archived to others. And so I think a part of this, my being here as a journey in the life of a physician, I have many, many thanks, because I did not get here alone. The successes that I have had been because of team members that I work with, but also due to family, to friends, and to the God that I serve. Next slide. I want to show this picture. This is a 5-generation picture of me when I was much younger, with my daughter at the time, who was 2, my mother, who just turned 92 on Monday. My sister is next to her, and in pink, or rose colored, is my great grandmother, who almost lived to 100, and her daughter, who's my grandmother. And believe it or not, I even knew my great grandmother. Unfortunately, we don't have that picture. So I have a long legacy of Black women who have nurtured, who have embraced, who have empowered, who have been my cheerleader for years and years. And so I want to give thanks to the many women who were part of my life. And these women did not have all the opportunities that I had. And without them, I would not be where I am. I think of in pink, what we called her Mother Dear, which was my great grandmother. You know, the story in our family is that my mother, who stands behind her, had one brother. And this woman, we called her, well, her name is Mary. And we called her Mother Dear, but she worked. She was she ironed clothes, she took in wash, she did day work. And she helped my grandmother, who lived in a coal mining town, to get money for education for my mother to go to college. And it was just my mom and her brother. And this woman, Mother Dear, said, and her daughter said, it's so important for women to have an education, that although my mother was younger than her brother, they saved money, they worked, and sent my mother to college, who's the first college graduate in our family, who was then able to see the importance of education, and then sent my sister and myself on to college, graduate education, and the like. My sister, who stands in the dress with the white, I can tell these clothes are very old, but outfit in the back, went to Yale University for her undergraduate. She's one of the first women at Yale, and then went on to Columbia University for her MBA. And my mom is visiting her now at my sister's home in the Bahamas. And then I have myself and my daughter. And so I just want to raise my hand and give thanks to the many women that really bolstered my confidence, kept encouraging me to move on, and were there to listen, to cry, and to celebrate the joys that I've been able to have, both personally and in my community. So I just love this picture. Only wish what I call Granny was in that picture. I think I'll have to Photoshop her in one day. But again, I come from a long legacy of great women. So I want to give a shout out to them. Thank you. So you can just click on the next slide. So a couple of things I want, this is a picture of sort of staying in the dark. And what I'd like to say to this slide is that as women on the call, or community that's on the call, for women's healthcare, a lot of things are still in the dark, things that we don't talk about. Domestic violence, incest, problems with fertility or infertility, fibroids, problems with hypertension, diabetes. Almost all of the markers of health disease are greater when we look at complication stage of disease that women present with, especially for women of color, for Black women. And I tell my students, if you had to take a multiple exam and there's a question about which group of patients has the greatest burden of disease, you can almost be right all the time by choosing the category of Black women or Black individuals. So again, all of the cancers for the most part are greater, especially for the GYN cancers, endometrial cancer. We find that cervical cancer with worse outcome, later disease, issues as it relates to hypertension, diabetes, kidney failure, a lot of problems we see. And I think it's important to open Pandora's box and get from behind a closet to talk about many of these issues. And for today, I would just say in my time here in Cleveland, many of the things I've done, I'm always sort of preaching the importance of self-care and making people more aware of the things that they may be able to do to help themselves. Next slide. So what was the light bulb moment for me in medicine? Part of it was sort of looking at my own family and deciding, well, what could I do differently? What opportunities did I have? What experiences did my mother, grandmother, other women in the family have? So for instance, my mother was born in the house where she lived back in the day. Again, my mother's 92, but when my grandmother was carrying her, sadly in West Virginia, white doctors did not take care of patients, and my mother was delivered in her home as a home birth, that we would call it today. My first cousin's mother, when she was born, her mother died in childbirth. Another aunt also had problems after discharge from the hospital for eclampsia, which is seizures of that you happen to get postpartum due to hypertension, problems with ectopic pregnancy, hemorrhaging, things like that. And even for my own self, a major complication during my own delivery with my son. And so I think my eureka moment, especially as I got older, there were a lot of secrets in my family where things were not shared about some health risks, health challenges, that as I heard stories and my own family became more comfortable sharing some of these stories, I've been trying in my career to really open the eyes of the women that I treat and serve so that some of these poor outcomes that we experience do not happen. So I'll have you do the next slide for me. So I think there are many opportunities sort of knocking at our door. We know that healthcare right now and racism in particular is a healthcare challenge. But I'm not somebody that just lets things sit, and nor are you. So I want to look at the opportunities that we have to improve overall healthcare for the entire community. Because when we're all healthy, families are healthier, communities are healthy, and I look at the opportunity for change. My sister has often told me when I'm deflated and feeling sad about situations and outcomes for my patients and things in the community, Jackie will say to me, you know, Linda, just get off your pity potty. Just look at the opportunities to speak and to share your knowledge with others in your community. So that's what I'm going to do right now with you, letting you know some of the opportunities that all of us have. This is not just for physicians and not just for the healthcare workers, but for all of us. And I'll have you to the next slide. For those of you that are raising physicians, are a physician, work with physicians, this is meant, and I didn't know exactly how many docs are in the audience, but these are things that I've learned that I also think translate to all specialties. Whether you're a physician, teacher, nurse, lawyer, whatever you do. I think it's important to be a lifelong learner. And never to stop learning. Because I think, especially in medicine, but in everything, the minute that we slow down is the minute you become a dinosaur. I remember finishing all these 12 years of training, taking my final board exam, which I thought was my final board exam. I'm like, oh my God, I don't have to take another exam in my life. But even the things that I'm doing now as a surgeon, I did not do an internship or residency training, or even the first 5 or 10 years after training. What do I mean by never stop learning? My husband is a physician. We met in medical school, but during COVID, we cleaned out our attic and on our 3rd floor. And I looked at all the books that were highly underlined, the things that I had memorized, almost all the things, medicines that we would use in pregnancy prevention, hypertension treatment, diabetic treatment, all that stuff was all old. And we've had to continue to learn. I've thrown away all my medical school books for the most part, except for our anatomy book. Your anatomy just doesn't change. So again, never stop learning in any profession that you're in, because when you know better, you'll continue to do better. I think it's important to never ever lie about what you did not do, or should have done, or that. And so especially in medicine, what we are teaching, if you didn't do it or see it, don't say that you did. Don't say you examined a person's breast when you didn't, that you listened to their heart or lungs. But again, take this to the role that you're in now. If you don't know something, say you don't know, and then find out. So I think honesty, integrity is extremely important for all of us. I always think that that's an important caveat. Now, I put in here, never get sick. Of course, that's a little bit of I hope it'll put a smile on your face. But again, when I put this here, it's important, and I put it as a placeholder to say that we must take care of our mental, physical, and spiritual self. And so despite how busy we are as women in general, and sometimes the expectation of, quote, the strong Black woman, that's not a good, I don't like that statement, because I think we all get to let our hair down, to feel sad, to want to cry, to get help, to speak with therapists. And it's important that we do take care of ourselves in any role that we play. And I can just, again, a few examples, I can just remember for something I did that was, I'm embarrassed to say, or as a doctor, I can prescribe medication for myself. I could have someone take my blood pressure. I can do a lot of different things. And there was something I was doing for myself where I was self-treating. And finally, I wasn't getting better. And I finally went to my internist that I hadn't gone to in a while. And she says to me, when she looked at the labs that I had ordered on myself, the medicine I had put myself on, she says to me, well, who is your doctor? And all of a sudden the tears just came. You know, who's been treating you? And I had to say, I'm doing this. And whatever I thought I had as a disease was not the disease, was not the right diagnosis. So I think, again, taking care of yourself, if you're not a doctor, don't make a diagnosis of chest pain as being, oh, I just ate too much spicy food. It could be heart disease. Don't say, oh, my breast exam, I think I feel a lump, but it's probably nothing. I'm overreacting. If you're down and sad, don't just think, oh, because it's cloudy day, bad weather in Cleveland, that you're just going to get over it. You may need to speak to someone. And so I put this in here to remind us to take care of ourselves. Next slide, please. And for those of us who are going into professions, I don't care if you're going to med school, law school, business school, studying for any type of exam, sometimes we are not happy with our score. And I can say that for myself. I didn't always get the top score on SAT exams, MCAT exams, or any other exams. And sometimes we compare ourselves to others. So what do I mean when I say you were more than the sum of your test scores? I'll let you, Ms. Thomas, advance that one more time. We'll do that. Because there are other things that make us who we are and make us great at what we do for ourselves, our community, and our family. Think about your creativity, your critical thinking. These are all assets. Next point. Think about your resilience, your perseverance, your motivation, your curiosity, your humor, asking of questions, your enthusiasm. Next. and also your reliability and endurance. So there are many things besides just a number that cannot only define you. When I think of myself down through the years, I think of all of these things as a part of who makes me, me, and how I think I can contribute to an organization, to a school, and to my community. So again, you are more than the sum of your test scores. Don't forget compassion and courage, self-awareness, empathy, your leadership, understanding your nature, understanding the sense of beauty and wonder. These are all kinds of things that when you're down on yourself, think about other things that you do, your spontaneity, your resourcefulness of doing things, your humility. So again, I think that's very, very important as we counsel. As we say, it takes a village to raise a child. Sometimes we don't make the team, but what else could you bring to the team or to a different team? So I think this is important. And many of the things in our healthcare system, I love Maya Angelou's quote, when you know better, you do better. And the other is when you learn, you teach, and when you get, you give. I put this in here because I think this is just a little bit of a train of thought, the difference here. The importance of philanthropy, of giving back. My pastor, when I was at Antioch Baptist Church, would say, you need to give up your time, T-I-M-E, as well as your tithe, T-I-T-H-E. And so again, there are many ways that we learn, or we can teach, we can lift up, pull up, help others. And I think it's really, really important. And I just put this in there for us not to think about it. And the other thing is we have to think outside of our box. I grew up around the Cleveland Clinic and the Huff community until about second grade. And the reason for my parents moving, my sister and I, was that we could only go to school half a day. Back in the day, school was overcrowded, and my parents knew that kids at a certain age, this was not preschool, you need a whole day of school. And so I think when I listened to my mother, and my father passed away not that long ago, I think about what they did and the resilience of my grandparents and great-grandparents. In fact, Mother Dear was born in 1890, but she was just like the first generation, coming out of slavery, really, in this country when she was born, a generation and a half. But what did they do? What did I feel? How was it palpable, their experiences that helped me? One is that they always reached for leadership opportunities. They helped others, and I modeled a lot of that behavior. Nowadays, we would say we ask for help, get a mentor and a sponsor. They had different opportunities, but I saw that sort of frame of reference in thinking outside of the box to get ahead. And I found that these were women that were very organized, very scheduled, very task oriented. And so instead of looking at barriers, think outside of the box, the skill sets that you have and what you really can do. Next slide. The other thing, and again, this is speaking to all of us, but also in medicine, we sometimes are working 24/7, constantly thinking, but also women that stay at home are constantly thinking, can get burnt out. And this issue of feeling burnt out happens to all of us. I'm not sure anymore if there's such a thing as work-life balance, but trying to keep all the balls juggling all the time can create problems. And so how do we keep from burning out? Next slide. For me, I've often said medicine is a jealous mistress in terms of the number of hours we work, but I also look at many other folks who are working one job, two jobs, a job and a half. So we could say medicine is a jealous mistress, but any job for which we've given all of ourselves can really impact our life in terms of stealing us from others and not being with our community or our family. So again, be careful with how much we're taking on, how often we say yes to anything that we're doing. Next slide. How do we keep from burning out? We have to love our body. Your doctor, your nurse practitioner, your PA can do all your blood tests, do your exam, say for that day that everything's good. But when you're really stressed out over time, today a result is normal. In 6 months, if we don't love our body, things can change on a dime. So what do I mean by loving your body? Next slide. It's important for us to just think about these, what I call stress busters, to keep us engaged and healthy. Getting to our most ideal body weight is important. If you smoke, stop. If you don't smoke, don't start. You know, sleep hygiene, our brain gets bathed in chemicals and cleans the toxins out of our body. So good sleep hygiene is important. Make exercise a habit or moving more. Find out what you like to do to move. Do those 30 to 45 minutes at least 3 to 5 times per week. It doesn't have to be all in a row, but making sure that you get your heart rate up. You might have to breathe a little bit more. But if you like hula hooping, if you like dancing, if you like walking up and down your stairs, I can't tell my patients what exercise would work for them, but every single one of us should have some way that we enjoy movement and start making that a habit. Have hobbies outside of your family life, your career, and your work life. Minimal caffeine intake is important. Avoiding stressful situations when you can. And I think the older I get, sometimes I say to myself, is any issue just worth the stress? And sometimes when we change our expectation for anything, it helps to reduce stress. So I think I summarize some of the things that keep us healthy as women, and I think will make us better stewards in our community by maintaining some of these thoughts. Next slide. Other ways to prevent burnout is to be organized when you can, have some goals, plan, don't overcommit, don't wait till the last minute. Some would say, can you use a coach, a therapist, prayer? There are many different things, mindfulness, all of those things can help us. Avoid being isolated. We know that during COVID, a lot of health challenges were due to just being by ourselves in front of TV, in front of Zoom, and not connected. It's important to have physical touch and to be in the space of others. So I'm glad we're able to get out now. Avoid negative coping habits. That could be alcohol use, drugs, cigarettes. There are just many things that we can begin to engage in that we may think help us, but actually defeat our purpose of living a longer, good life. I mentioned again the sleep hygiene. That wasn't something that was really taught in medical school, and we do know that everybody's sleep number of requirements vary. We usually say between 6 and 8 hours, sometimes up to 9 hours. So it's important to get good sleep and consistent sleep because it takes a while to bounce back when you've had sleep deprivation. It's important to also enroll in activities that you like, that have positive distractions. For me, I enjoy cooking. I also enjoy teaching others how to cook. I enjoy being involved with my community in so many different ways. But there are other people that like to sew, that like to sing, that like to travel. There are many different activities that one can be involved in. And again, I use the word exercise, but I probably can use the word movement because sometimes my patients will get a little upset with me, you know. So I found myself saying, can you move a little bit more rather than exercise? Because for some people that has a negative connotation. Next slide. And I also think as I begin to close here, sometimes we think, speaking really to myself, woe is me, I'm overworked, I'm stressed, I'm on the go. But sometimes I just have to have a gratitude journal, or just to say I am grateful for. It may not be written down, but when I wake up, you know, for me, it's to say, thank God I'm here and I'm alive. Thank God I have my mother, my family. Thank God I was able to make a diagnosis and help a patient. I did surgery the other week for someone I know who's going to have a phenomenal outcome. I thank God for having the hands that have been gifted to me to help others. So sometimes I just say I'm grateful for, instead of listing all the negative things that I might feel and sort of regurgitate to myself time and time. So I found that this was very helpful. Next slide. And I also think forgiveness. There are some burdens and some stories and some situations and some things that have happened to all of us. And we can all carry a lot of energy. And I think forgiving is a big portion of getting better, releasing some of the negative energy. And I find that this has been helpful in my lifetime, about forgiving others, forgiving myself for things that may have been done to others, said in a way that could have hurt others, but we have to forgive others and we have to forgive ourselves. That has been a growing moment for me, my sort of eureka moment. Next slide. And then also, sometimes we find ourselves in situations, I saw this slide not long ago and I love it. It says, not every place you fit is where you belong. I think on Facebook the other day, I just saw something that says, be like an elevator, you know, as you go up in life, sometimes the elevator opens doors and people get off. Sometimes we have to let other people out of our lives, right? And in this picture here with the garlic clove and the orange segment, does something fit? And if you've been doing something for a long time, maybe it's sometimes time to change. And so again, allowing some flexibility to being able to pivot is quite important. I found this extremely helpful in my own life and also in raising family to sort of have this philosophy. Next slide. And again, coming to the end, I love this because I failed. I don't think there's anybody that walks this earth that has never failed, but I saw this, it says, if you fail, never give up, because fail, F-A-I-L, means first attempt in learning. End is not the end. In fact, end, E-N-D, means effort never dies. If you get no as an answer, remember, N-O means next opportunity. So just continue to think positively. I just love these isms, so to speak, and I'd like to share that with you today. Next slide. And Benjamin Franklin says, when you're finished changing, you're finished. Without continued growth and progress, such words as improvement, achievement, and success have no meaning. I just kind of embrace that. I really love that. I think the next slide is my last one coming up. Yes, and so just keep reaching, think about tomorrow, think what you can do, where do we need to sort of retread our shoes, and think positively. All hands on deck are so needed, especially in this era, this time, and this moment. And I hope that there have been a few words of wisdom here, a few things I've gathered along the way that keep me centered, keep me focused, and I hope keep me helping others. And I was asked to kind of keep this to a certain length, so I hope I have enough time for any questions that might be in the chat or for Ms. Thomas to ask me. Thank you so much for this opportunity.
Thank you so much, Dr. Bradley. And as she said, she is ready to take your questions. So if you want to either come off mute or type them in the chat, you are welcome to do that. Lolita?
Hello, Linda.
Oh, I see you up there. How are you?
I'm well. How about you? I love the picture in the beginning with your mom and
Grandma.
Kathleen, and yes, so I love that. Yeah, I wanted to thank you for your words of wisdom, and I wanted to know, like breathing exercises, meditation, do you recommend any of that kind of thing? You know, when I think about stress, and I'm learning, and actually at my church now, and I'm at Olivet now, and like the 15 minutes before church starts, we do meditation, you know, just everybody getting still. And I've learned that the breathing does help, and breathing correctly, you know, breathing through my nose and breathing out, you know, and just how it does relax you and get some of that stress. I didn't know if you had any other words of wisdom.
I think just as a person and as a physician, I try not to be too prescriptive. And there's lots of science behind breathing, movement, mindfulness. You know, some have said, depending on your religious believe that they quote, don't do yoga, that folks believe in prayer, power of prayer. So what I say, what works for you? And the same thing with, like I mentioned earlier about prescribing exercise. If you think back to Michelle Obama's campaign, it was let's move. And when we look at what that meant, it means about 30 to 45 minutes, at least 4 to 5 times a week of different kinds of exercise using different body parts. But the thing that's helped me, even in my own life, you come to my house, sadly, and this equipment is very old. My kids are young adults now, and I have a treadmill that's old as dirt, but I found out that, I need to exercise 45 minutes a day. I get up at 5:30, and then I'm like, I've got to do something. I've got to blah, blah, blah. I don't have 45 minutes. The take-home message now for my patients from different studies that I've read or we are taught, if you broke up your exercise, 3 15-minute slots, 4 10-minute slots of or movement exercise, you're more likely to not say, I don't have time for 45 or 60 minutes. So I would say for exercise, we know that for mindfulness, you're absolutely, that's true. We're finding there's a school in New York where they had a lot of problems with kids and going to the principal's office. So movement, quietness, stillness works for children. There was less discipline, less kids sent to the principal's office, deep breathing. And I try not to be too prescriptive. You just take your deep breaths and relax. We can do that when we're in a hot situation, when a car cuts us off, when someone interrupts. So just know, I don't think there's a perfect way, but there's a way that works for you. So silence, being still, being quiet is so important. And this may be meandering too much, but the Cleveland Clinic has an ongoing or new study about dementia and Alzheimer's. And they're looking to enroll 200,000 people, and they basically are following us for a whole life to look at other things in our lifestyle, environment. But one of this thing, I just did this about a month ago, but you get an hour and a half MRI of your head, all of these neuropsychological testing, different kinds of things. When I went into the MRI, the guy said to me, he says, what kind of music do you want to listen to? Because you'll be in this machine. It was almost an hour and a half. I said, I don't want anything. I did just what you're saying, Lolita, is I wanted quiet. I did my breathing. I wanted no music because I'm always on. And so sometimes, like in my car, someone said, did you want Cirrus or whatever it's called? Sometimes I just drive to work. I don't want to hear anything, because all day I'm listening to beepers and phones and things like that. So whatever you're doing that can kind of center you is good. And I don't think there's an improper way to do it. So celebrate those quiet moments at your church, before or after service, or whenever you can, periodically throughout the day. That's great.
I'm glad you brought up that study, because I'm part of that study too. I joined last year, and I'm going for my second, because mom had Alzheimer's.
Yes,
and I know they are looking for African Americans, because they did not have a lot of African Americans.
Correct. So as a physician, and this is a separate thing, I think it's very important to be a part of clinical trials when appropriate for what you can do. Whether you give blood, this is not a trial. Can you or someone in your family give blood? Like this past week in the Cleveland Clinic, the communities around, we were low on platelets. That's the sticky stuff that makes you stop bleeding if you're hemorrhaging. So there are many things that we can do besides being good citizens and servant leaders. That's good for medicine. And so for myself, throughout my career, I've done I've volunteered for several studies, and this last one, I do wish I knew the results. They don't share the results with me, but it was interesting to do. Thank you.
Yeah, thanks again, and good seeing you.
Thank you.
Thank you for your question, Lolita. So Dr. Bradley, thank you for sharing that you've both not only led clinical trials, but also been a participant. Let's talk a little bit about the process of translation. So translation being turning in observations in the lab, clinic, and community into interventions that improve the health of individuals and the public, from diagnostics and therapeutics to medical procedures and behavioral changes. What opportunities do you see for advancement of equity, health equity, through translation for women's health?
Well, I think that's a big question with, I think, a couple of ways that I would answer that. I think we first have to have a lot of storytelling. A lot of meaning we have to listen to women and to men and to children, because doctors and nurses and healthcare professionals may not see the whole story. So when we're translating, for instance, I'm a gynecologist, so I would just say, what have we done in medicine, in the field of fibroids? That's my big area of interest. And we have listened to women's stories, listened to their quality of life. We've begun to understand size, number, and location of fibroids may matter. So to me, the translation for equity is first listening, examining the patient, and then using technology that may enhance the ability to make a diagnosis, understanding a disease process. I just completed 2 clinical trials for fibroids, and I'm very pleased to say that there are 2 new drugs that are out for fibroid-related bleeding and symptoms. I'm also proud that as a part of this trial 5 years ago, saying that the biggest burden of disease is among Black women, we have to enroll around the country Black women in clinical trials with big fibroids of early age and onset. But the translation went from, I don't know if I'm getting to this exactly, but understanding the problem, making sure we know who has a burden of disease, being included in the trial, looking at dosing, whether it's body weight, whether it's age, whether it's number of fibroids, and then pulling all that together to say, what do we want to study? And so for me, that's been a big part of my clinical practice. I'm not a bench researcher, but when we're looking at new developments, we want to look at things that, how we should study them, what questions, and being inclusive. And so as I look through everything, it's important. I'm not sure if that's truly the way you wanted me to sort of develop the answer to this question, but that's how I look at this.
No, that was perfect. That's translation. Now, patient involvement is a critical feature of all stages of translation. We touched on in your bio, and you shared some tidbits in your story about how you've involved patients in all of your work in community engagement and outreach. What are some strategies that you developed over your career that help increase patient involvement in all stages of research?
Well, the first thing, I think you have to have people in a trial that look like you. So it's important for Black physicians and brown physicians or women physicians to lead trials or to be a part of the team. I think we have to be at the table. I mean, this is not to minimize a drug. There was a drug that was developed in Europe for fibroids, for instance. When I looked at the outcomes, only 5% of the women were Black. They would be from the African diaspora. So I look at those numbers and I say, but they didn't enroll very many patients. I look at the weight of the patients. I'm like, will this drug work in a certain patient population? So in order to make an impact, I think nurses that do help us with our recruiting and retention, you need to have people that are like you to answer questions. And I think, you know, having a beautiful quilt, all different kind of, beautiful fabric, and you weave that together to make a beautiful quilt makes things better. So I think in medicine, being a part of the thinking process, what do we need? Whether it's for breast cancer, hypertension, infertility, just everything. How does the disease present to different people? What's the words that they use to describe? What's our questionnaire gonna look like? For Lolita, we took this test. One of them was a smell test, which is a test, I guess, to detect Alzheimer's. And there were 40 different, it was a scratch off. And there was things from gasoline to roses to pineapple, smell of grass, just different things. And you scratch it and then you would circle the answer. And when I looked at that, there's so many parts of that study that I said, oh my God, if you were not experienced, if you lived in the projects or an area that's cement city and you never smelled grass, you wouldn't know what that is. I love the smell of grass because my grandparents lived on the farm and Saturdays grandpa would cut the grass. There were just smells that, and I just thought for that study, there are going to be people that are smart, but just did not have the experience to be able to answer that. You know, I might be able, whatever, because I could go on and on. But that, when I look at developing a trial, what does it mean when someone with less than cannot answer those questions? You see what I'm saying? So it's important for our team to be diverse when we sit at a table, because everyone's eyesight and their ears are going to be very different. For now, my last little comment here, my mother's 92. She is not computer savvy. I look at her going to the doctor's office. She's not going to be able to sign in with the kiosk. We still must have people at the front desk to help be someone who can escort her, sign her in. And I just look at a lot of things now that's ageism in this country as I help my mother through her aging process or geriatric care. So, you know, are we translating it for everybody? When I see a sign up for something, is there a number you can call and ask a question? Or can you only sign up by being online? See what I'm saying? So there's a lot of things. The haves and have-nots will have certain, you know, things that they can do and others are interested but cannot do it. My last comment about medicine, and I am fighting, it's important. We have telehealth. See your doctor, talk to your doctor. But everybody doesn't have that. And we saw that in COVID, where everybody could not be on Zoom. So I believe in telehealth, but I also believe in the telephone. There should be no reason that patients cannot contact their doctor easily if they don't have access to computers and smartphones and all of that. So I think we can't be greater than or holier than thou, but we must always be centered. And I'm always thinking when I'm involved with things, well, what about the person that doesn't have this? Can they still be a part of the care that needs to be rendered? And I'll leave it at that.
Absolutely. Inclusivity, accessibility, you explained that beautifully. Thank you so much, Dr. Bradley. And I'd like to draw attention to the chat. There were a few questions about the studies that were mentioned, how people can sign up. Thank you to our senior director at the CTSC, Shannon Switkowski, for entering a couple of links so that people can check those out and potentially express interest or sign up. And then she also included a link to Research Match that's on our CTSC website.
That's great. Thank you.
All right. And thank you so much, Dr. Bradley. This has been an absolutely wonderful conversation with you. I learned a lot. I'm certain that many people on the call did as well. And we celebrate you and honor you and everything that you have done locally, nationally, internationally. You are absolutely wonderful.
Thank you. I know I didn't go a lot over specific women's health issues and obstetrics and gynecology. I don't know how much time there is, but if there are any other questions, I'm happy to answer those.
Thank you. So what's next? Join us 3 Fridays in March as we host fireside chats with leading ladies from each of our hospital affiliates. On March 3rd, we'll talk with Selena Kunanen, Chief Diversity, Equity, and Belonging Officer at University Hospitals. On March 10th, we sit down with Dr. Erica Steed, President and CEO of Metro Health. And on March 17th, we'll talk with Dr. Cynthia Cabu, Associate Director of the Neuroethics Program, Center for Neurological Restoration at Cleveland Clinic, and Vice Dean for Faculty at Case Western Reserve University in the School of Medicine. We have a pre-recorded segment with Jill Dietrich Mellon, Executive Director and CEO of the VA Northeast Ohio Healthcare System, that you can view on demand on our YouTube channel starting March 1st. So what can you do today? You can schedule a READY consultation at spark.case.edu. And READY stands for Research, Equity, Accessibility, Diversity, and Inclusion. You can sign up to attend future programming and join our listserv, and visit our website and review CTSC DEIA resources. And in the spirit of taking care of ourselves, we'd like to give you some virtual commute time. This is a couple of minutes for you to engage in meaningful activity that will help you commute back to yourself before your next meeting. Move, breathe, engage your senses. Take some of those tips that Dr. Bradley gave us. And this is coined by Dr. Jennifer A. King. She's co-director of the Center on Trauma and Adversity and assistant professor in the Mandel School of Applied Social Sciences at Case Western Reserve University. She'll also be a part of our unmeeting on Thursday, March 16th. That's next month from 10 a.m. to 2 p.m. It's virtual, it's free, and we hope that you'll join us as we talk about health disparities and sparking conversation to help inspire the next really powerful and impactful research question about health equity and, really just making things better for everyone and improving health outcomes. Thank you so much for joining us. Have a great afternoon, everyone.
Thank you.
Thank you.
Okay, bye-bye.